Hi, good afternoon, Hilton. I am Mihiraa. Let's start the warm-up session. Tell me about a time when you had to handle a difficult patient.
In a previous role, I encountered a challenging patient who was anxious and uncooperative. I first took the time to listen to their concerns, empathizing with their fears. I then explained the treatment plan in simple terms, ensuring they understood. I involved their family for support and collaborated with the healthcare team to provide the best care possible. This approach helped build trust, and the patient's cooperation improved.
How would you prioritize and coordinate a complex patient?
I would start by assessing the patient's overall condition and identifying any urgent issues. I would then communicate with all specialists involved to create a cohesive care plan. Prioritization would depend on the severity and urgency of each condition. Effective communication, collaboration, and regular reassessment would be key to ensuring the patient receives the best care.
How do you ensure that you provide patient-centered care?
Patient-centered care is essential. I always take the time to get to know my patients, asking about their preferences, cultural backgrounds, and individual needs. I respect their choices and involve them in their care decisions. By doing so, I can tailor the care plan to their preferences and ensure they are comfortable with their treatment.
Can you provide an example of a time when you had to work as part of a healthcare team to achieve a common goal?
Certainly. In my previous position, we had a complex case that required collaboration among nurses, doctors, and support staff. I actively contributed to team meetings, shared insights, and offered assistance when needed. By working together and utilizing each team member's strengths, we successfully managed the patient's condition and achieved our shared goal of delivering quality care.
How do you handle conflicts with colleagues or superiors in a professional setting?
Conflict resolution is crucial in healthcare. When conflicts arise, I strive to address them calmly and professionally. I prefer open communication, so I would approach the person involved and listen to their perspective. I express my concerns and seek a mutually beneficial solution. If the conflict persists, I'm willing to involve a supervisor or mediator to find a resolution that prioritizes patient care and team harmony.
Thank you. Please prepare your role play. Please start the role play.
Good afternoon, Mihiraa. I'm Nurse Hilton Ray. I understand you've had carpal tunnel surgery today, is that correct?
Yes, that's right, Nurse Hilton.
All right. Mihiraa, I'm here to provide you with information about caring for your wound. How are you feeling after the procedure?
I'm a bit sore, but I think I'm doing okay.
All right, Mihiraa. I want to ensure you have all the information you need to care for your wound properly. After your surgery, it's important to remove the outer dressings in 24 hours but leave the dressing on your wrist in place. This helps to protect the area and promote healing. Throughout this process, it's crucial to keep the dressing clean and dry. This helps to prevent any infections and ensures the best possible outcome for your recovery. In terms of the healing process, you can expect it to take around 2 weeks for your wound to fully heal. Your sutures will be removed within 10 to 14 days, depending on how well your wound is healing. During this time, it's important to follow the care instructions closely to support the healing process and to avoid any complications.
Okay, got it. However, I used to swim every day. So, can I cover the wound with plastic and still swim?
I understand that you're eager to resume your normal activities, including swimming. However, it's crucial that we prioritize your healing process and ensure the best outcome for your recovery. Swimming, even with the wound covered in plastic, is not recommended until your wound is fully healed. There are several reasons for this. First, covering the wound with plastic is not completely effective in maintaining dryness, which increases the risk of infection. Additionally, immersing the wound in water can lead to a longer healing time and potentially compromise the success of your surgery. Mihiraa, it's important to make sure we're on the same page regarding the care of your hand post-surgery. Can you tell me what you understand about the care instructions so far?
Yes, I understand. I'll refrain from swimming until my hand is fully healed.
Excellent. Additionally, Mihiraa, it's important to keep in mind the care instructions for your hand as you continue your recovery journey. Remember to elevate your hand to minimize swelling and try to limit its use for the next 48 hours to promote healing. Additionally, gentle finger mobility exercises can help maintain flexibility and reduce stiffness. If you experience any discomfort, please don't hesitate to take pain relief medication as needed. Regarding precautions, it's crucial to avoid heavy lifting and driving until your wound is fully healed. This will help prevent any strain or complications that could prolong your recovery. Do you have any other questions or concerns about caring for your hand or any aspect of your recovery?
Thank you for the reminders. I'll be sure to keep them in mind. It would be really helpful if I could receive some written instructions to refer to after discharge. That way, I can easily address any doubts that may arise.
Absolutely, Mihiraa. I want to ensure you have all the necessary resources to support your recovery once you leave our care. Your discharge pack will include vital information such as details about your follow-up appointments, guidance on wound care and medication, as well as exercises to aid in your hand's rehabilitation. It's essential to have these materials readily available for reference. Moreover, I want to emphasize when it's crucial to seek medical attention. If you experience any concerning symptoms such as fever, significant swelling, or increased pain, please don't hesitate to reach out to us or seek medical assistance promptly. Your well-being is our priority, and we're here to support you throughout your recovery journey.
Thank you, Nurse Hilton. I appreciate all the information.
You're welcome, Mihiraa. If you have any other questions or concerns, feel free to ask. Take care, and I wish you a speedy recovery.